Okay, thank you, Kisa. Ladies and gentlemen, this is the materials that I would like to share with you. So basically we have the humanitarian movement. It's called SONJO, and we work for three sectors actually: health, economy, and also education. And why is it that this idea of SONJO came up is actually partly because of this poster. You know, it was this poster. It was in March 2020, and our government declared the first COVID case in the 2nd of March 2020. But then my question is that, is it really that, you know, this is it's typical the situation that we have? And in my opinion, it's not. One is that we are not in the sea. Second one, that actually we can work together through the internet. Indeed, that we cannot mobilize among a household, or we do the social capital like in the previous day when we had a disaster, usually natural disaster, because in Yogyakarta we live nearby the Mount Merapi, but this is not the case, you know, and that's what we think, and that's why we try to promote the social capital. So in these circumstances is that, you know, we talked to ourselves and we said, look, the COVID is basically the common enemy, and it may take 3 to 4 years to control the pandemic. And if we want to create the movement, then the sustainability is paramount in here. And from the beginning of the formation of the SONJO, we always talking to our members that 3 strategies: expect the unexpected in terms of the impact, and then thinking the unthinkable, or thinking innovatively and adaptively in terms of the alternative solution. And the last thing, which is the most important thing, is how to mobilize the resources. Now, talking about the resources, you know, many people usually when they start working on a social capital like this, or the humanitarian movement in Indonesia, they usually tend to rely on the government. But as an economist, I know exactly, you know, the government, our Indonesian government doesn't have sufficient money for this. And if you see the budget deficit that the government did is actually quite minimum in comparison to other countries, for instance. So basically our budget is about 1/6 or 1/7 of our GDP. And then what I'm thinking is that, you know, that actually the resources are actually out there. Everybody has the resources, but the problem is how to channel the resources among the resources to create outcomes. So this is the idea. And we have a local wisdom. It's what I call Sambatan. Sambatan is actually working together to build a house in the old days, traditionally, yeah, and nobody paid in the circumstances. And you just work for 3 to 4 days to particular families, and then voila, we have a house. And then we do the rotation, you know, and everybody who need their house will be refurbished, then they can ask their neighbor to do so. So this is the idea, and we use the similar approach, whereby in SONJO we do not allow any funding whatsoever. Why? We don't receive any funding. What? Why? Because we are informal movement, basically, and based on the OJK, or the Financial Service Authority regulation, we're not allowed to receive any funding elsewhere. So this is what is SONJO, basically. So what is the focus is on the vulnerable people and helping vulnerable people and people at risk in Yogyakarta due to the pandemic. And the values is based on the integrity, transparency. And why is it? That's because the earliest stage of SONJO is actually we are formed by the academic activists, anti-corruption. So that's why we promote the integrity and transparency, and we always comply with the government regulation. Now, we also, when we design SONJO, actually we take into consideration that Indonesian people love to play with the gadget. You talk about WhatsApp group and things like that, and the study shows that we spend on the average 3.5 hours per day to access social media. So I'm just thinking, what would happen if everybody just spent for half an hour to share in this? So that's why we use the WhatsApp group. Yeah. Okay, so this is SONJO. We have 18, because we are based on the WhatsApp group, we have 18 WhatsApp group at the moment. And the members was about 1,700 members, and what is that? The program, we have about 20 programs. Now, this is the program. Then this is the way that we work. You know, we manage the knowledge management. So basically, we have two program. It's called Angkringan and Migunani, which is something that's like webinar basically. And then we put it in the live streaming video recording, and then all materials is uploaded in our website. And then we also have a living document. So this is the way to monitor the program. Now, this is our program in economy. I don't want to spend much time in here, because basically what we're trying to do is we're trying to support the SME to transform from physical transaction to digital transaction. And at the moment, we start to think about exporting some of the product. So it's not only how to talk about how to survive, but we start talking about expanding to export. Now, this is the program for the health. I don't want to talk about the one in the blue, but I want to concentrate in the red. The blue one still exists, but the red one is actually, the orange one is the one that, which is related to the program that we discussed today. So this one is start in, this problem is actually, why is it that we have what I call Rimawan? SONJO Rimawan is one of the WhatsApp group. And this one emerged because of the problem of the search of patient in December 2020. And at that time, prior to that, we have local election and we have long holidays for several times. And it was a spike increase, and the pressure, it was paramount at that time. And our colleague from health asking, will it be possible if we use, we create some sort of like a WhatsApp group in order to help the hospital in Yogyakarta to do the referral system? And then we created that, and then they complaining about the referral system. And then when I checked the referral system, it's, of course, it will be very difficult. That's why we created a new system, this alternative system using the double option. And using only WhatsApp group and Excel to solve the problem. And this is the data that we have. So basically 119 patients managed to be referred using this system. And it's very, very simple, you know, using the WhatsApp group and also Excel. But then we keep it, we do it timely. Update timely. So that's why but then we have the problem. What is the problem? The system that we have is only for the referral within the, among the hospitals. But what would happen to the patient who's outside of the hospital and they want to get into the hospital? That is the problem. That's why we propose to the Regency of Bantul, and we talked to Pak Agus, will it be possible to create some sort of like hospital at that time? And then he said that, don't use a hospital term, because that will be very difficult. So why don't you use a shelter? That's why we have a shelter. So this is like a triple helix, basically, the way it works. And then that's why we have in Expat Masuri Hospital, we have new shelters in there. Now, on top of that, we also think about helping the shelters for the funding. That's why we have donation. And you may ask, but SONJO doesn't receive funding. Yes, we don't. We just use our colleague from NGO or CSO who work on this matters for the donation. They will collect they will collect the money, but then the disbursement is up to us. And also all of a sudden some here, that's a colleague from the medical school said that I will make a donation. playing a concert, and then all of the money we receive, we'll give it to SONJO, and it's up to you to donate. So we have here, that's why this is the coverage that we have. Is one Regency shelter that we help in 44 village shelter, 2 village shelter in Sleman, and 1 village shelter in Bantul. And then we also, just recently, just last week, we said that, because we expecting the surge in the second wave, that's why we create the SITANGO. SITANGO is basically the database for shelters in Yogyakarta. And this is a still ongoing project. At the moment, we have 47 shelters across Bantul and also Sleman, and we're still working on it. Also, we have what I call SONJO. SONJO is the program for disposing the health waste, basically, and we work with the village of Panggung Harjo. Now, the last one that we're trying to do is trying to help the shelter in terms of funding or operating costs, and how to give some sort of like voucher. And in order to do so, we link with the Pasar Desa. So Pasar Desa is like apps that link between the shop, farmers, traders, and everything, and even the delivery courier to the patient. So this is the way to do things. Okay, that's it. I think that's from me. Thank you very much.